Aortic stenosis occurs when the aortic valve of the heart narrows. This narrow prevents the valve from opening completely, which reduces or obstructs the blood flow from the heart to the main artery of the body and the rest of the body.
Aortic stenosis is a heart valve disease that affects as many as 1.5 million Americans. It becomes more common with age, affecting 1 in 10 people over the age of 75. Left untreated, severe aortic stenosis leads to decreased quality of life, heart failure, and even death. Aortic stenosis occurs when the aortic valve, the main outlet for blood being pumped from the heart to the body, becomes abnormally narrowed. In older adults, stenosis is typically caused by wear and tear and the gradual buildup of calcium deposits that stiffen and narrow the valve, keeping it from opening properly. As the valve narrows, the heart has to pump harder to push blood throughout the body, and this can lead to symptoms like fainting or nearly fainting during exertion, chest pain, weakness, and fatigue. While not all aortic stenosis patients experience symptoms, 3 out of 4 older patients with severe aortic stenosis do. However, many dismiss these warning signs as normal aging. This often leads to the underdiagnosis of aortic stenosis. Those that experience aortic stenosis symptoms have diminished quality of life, making everyday activities like climbing stairs and walking increasingly difficult. If you or a loved one has aortic stenosis symptoms, it's important to seek medical attention promptly. Simple tests are used to diagnose aortic stenosis. Aortic stenosis produces a very distinct heart sound, a murmur, and is usually detectable with a stethoscope. But other tests may be necessary. Over time, aortic stenosis strains the heart, causing the heart muscle to become thicker, weaker, and scarred. Without treatment, severe cases lead to heart failure and death. Medications can treat chest pain or other symptoms, but none can reverse aortic stenosis. Only repairing or replacing the defective valve will eliminate aortic stenosis. Without surgery, 50% of patients with severe aortic stenosis don't survive more than 2 years after the onset of symptoms. Aortic stenosis treatment typically requires aortic valve replacement surgery, or AVR. This surgery replaces the defective valve with a mechanical or tissue valve. AVR improves quality of life and increases survival in most patients. But those at high risk for surgical complications may not be good AVR candidates. Fortunately, recent medical advances give new hope for those who cannot tolerate more invasive surgery or are at high operative risk. TAVR, or transcatheter aortic valve replacement, is a new technique in which a valve is placed by inserting a catheter through an artery in the leg and threading it to the heart. This procedure is minimally invasive and does not require the chest to be opened. There are risks associated with TAVR, including stroke and damage to leg vessels. Aortic valve replacement is still the preferred treatment for most aortic stenosis patients, but TAVR represents a potentially life-saving alternative for those who cannot tolerate more invasive surgery. If you or a loved one has been diagnosed with aortic stenosis or is experiencing symptoms of aortic stenosis, talk with a healthcare professional right away. Get prompt medical attention for fainting or nearly fainting during exertion, chest pain, weakness, and fatigue. And remember, aortic stenosis is a treatable condition, and older age is not a barrier to valve replacement. Brought to you by the Alliance for Aging Research, with support from Edwards Life Sciences.
The heart works harder. When the blood flows through the aortic valve is reduced or blocked, the heart must work harder to pump blood to the body. Over the time, this extra effort limits the amount of blood that the heart can pump, which can cause symptoms and possibly weaken the heart muscle.
Patient will become weakened, short of breath, develop chest pain.
These classic symptoms fit a number of health conditions, so it's not uncommon for aortic stenosis to get picked up late in elderly patients.
More often than not, it's just deterioration of the valve from the aging process where calcium will build up on the valve.
Aortic stenosis may be undiagnosed in hundreds of thousands of people across the U.S. They have symptoms but don't recognize the urgency.
If you have severe aortic stenosis, the mortality in the first 2 years is about 50%.
There is no medical therapy to cure aortic stenosis or slow its progress. The only treatment is an operation to replace the valve. By the time many elderly people learn they have it, they could be in poor health facing surgery.
The standard operation was to open somebody's chest, put them on the heart-lung machine, stop their heart, open the aorta, cut out the valve, sew a new valve in.
Greater awareness may lead to earlier detection. 75% of patients are male. Calcium buildup is the most common cause. It is also linked to a congenital heart defect and rheumatic fever. Risk factors are age, hypertension, smoking, elevated lipoprotein A, and high LDL cholesterol. Surgeons are now able to operate on people once considered too weak for open heart surgery.
Utilizing basically the same sorts of valve materials that are available through standard operation, but now delivering it by a catheter.
Called TAVR, a new valve is delivered through a catheter threaded through the arteries in the groin or directly through the chest wall, expanding treatment for one of the most heart-wrenching conditions. For Lee Memorial Health System, I'm Amy Osher.
Surgery. Treatment depends on the severity of the condition. You may need surgery to repair or replace the valve. If left untreated, aortic valve stenosis can cause serious heart complications.
In patients with aortic valve disease, they form into two big categories. Patients who've got aortic valves that have narrowed down and are calcified, and that's typically in elderly patients. And the patients who have leaking valves, those are typically younger patients.
A leaky aortic valve can possibly be salvaged and repaired, particularly if you have a type of valve which fairly many people are born with, what we call a bicuspid aortic valve. So we are doing repairs of those valves. If the aortic valve cannot be repaired, we would have to replace it. And if you replace the valve, there are several options. You have a choice of having a mechanical valve which has a very good long-term durability but requires Coumadin, or have some kind of a tissue valve.
For the majority of patients with just an aortic valve, we do it as an invasive operation.
Minimally invasive means that we try to get to the part of the heart on which we're operating on through a smaller incision. We do a 2 to 3 inch incision right over the aorta and split the upper part of the sternum and get right down to the aortic valve. The advantages of a minimally invasive surgery is that you get a smaller scar, you get a little bit less pain, you get less chance of blood loss, and you may leave the hospital earlier.
I think it's important for patients to understand that for open aortic valve replacements, in our hands at the Cleveland Clinic, for a patient less than 70 years having a primary isolated aortic valve, the risk of death is only 0.25%.
What we can offer you is our ability to do any thinkable aortic valve procedure and try to give you the most optimal procedure for your disease and your, say, lifestyle. That's really where it makes a difference.
When to consult the doctor. If you have a heart murmur, your doctor may recommend a consultation with a cardiologist. If you have any symptoms that might suggest aortic valve stenosis, consult the doctor immediately.
High-risk patients facing open heart surgery because of aortic stenosis now have another option. Dr. Jacob Chino is an interventional cardiologist with renowned Institute for Heart and Vascular Health. Quite a title there, doctor.
Wow, hi. Thank you very much for having me today.
You bet. Welcome to the show. First off, really quickly, what is aortic stenosis?
Aortic stenosis is a condition as we age, the aortic valve, the final valve exiting the heart, becomes thickened and calcified. reducing the blood flow from the heart to the rest of the body.
Making it hard to even walk across the room in some cases.
Absolutely.
TAVR, you've brought this now to our community. What is it?
Yes, it's called transcatheter aortic valve replacement, or TAVR for short, and it's a less invasive way to fix symptomatic aortic stenosis by bringing in a catheter from the artery of the leg and implanting a artificial heart valve across the diseased aortic valve.
Yeah, so it goes in there, it stays in there, it allows blood flow.
Yes.
You've done several of these now, a handful
Yes,
here locally.
we have done 5 successfully, and everybody is doing well. All the patients are happy, and their quality of life has been improved, hopefully.
Because it really goes from almost zero activity to back to almost normal activity.
Well, people with severe symptomatic aortic stenosis can have significant symptoms of weakness, shortness of breath, or difficulties breathing while exerting themselves, chest pain, blackouts. And with this procedure, we can improve those symptoms, improve the quality of life so they could go back to their normal life, and also improve their survival.
That's great stuff. Dr. Achino, thank you so much for your time. We appreciate it. He is here until 6 o'clock tonight taking all of your questions. Just dial 858-2222.